My case is about a 21-year-old Caucasian female that presented to the ER 7 days ago. She had been having nausea, vomiting, diarrhea, and diffuse lower abdominal pain times 3 days. On the third day, she started experiencing frank blood in her stool. Nothing had been able to relieve her symptoms. On her visit to the ER, she was admitted to the unit, and then the next day, she experienced a major drop in her platelets and started to experience some renal failure. On the day I was on her case, she had actually much improved. In her review of systems, she denied fevers, chills, did complain of some fatigue and weakness, which could be understandable considering her length of hospital stay. She denied any confusion, tremors, or extremity weakness. Currently, she reports she's not experiencing abdominal pain, diarrhea, nausea, or vomiting. There's been no blood in the stool, per reported by the patient. She reported no difficulty urinating, blood or cloudy urine. She said that the amount of urine that she was putting out was about normal for her. On her physical exam, she seemed to be doing well. She was alert and oriented times 4 with no extremity weakness. Her neck was symmetrical with a trachea midline with a right IJ in place and no JVD present. An auscultation of her heart, S1 and S2 were able to be here with a regular rhythm. There was no extremity edema. Lung sounds were clear in all fields. Abdomen was soft, round, symmetrical with bowel sounds times 4. Because of the lack of her medical history and the severity of her symptoms, a biopsy of the small bowel, gastric, and colon were all done. It was negative for malignancies, just showed some IBS. A retroperitoneal ultrasound was also done. Major findings were the kidneys lack hydronephrosis and just some thickening of the ascending colon. Blood cultures and stool samples were also taken. They were all negative as for now. Currently, her WBCs are 15. Her H&H is stable at 9 and 26. She has a creatinine of 1.2, which is down from the high of 3.5. Platelets are now up to 200. They did go as low as 40. The reticulocyte count is 5.3, which is also down. Her diagnosis would include pseudomembrane colitis, hemolytic uremia syndrome, and anemia. The anemia is secondary to the hemolytic uremic syndrome and the frank bleeding from the colitis. She was transfused on her third day with 2 units of PRBCs. We will continue to manage her with steroids, prednisone. She will receive 2 more Plex treatments. Continue to monitor intake and output, current and lab values. Tomorrow we plan for another CBC and BMP. And then we will continue PT as tolerated. We will also continue IV antibiotics that are being managed by infectious disease team.